Semaglutide is, to me, considered a designer weight loss medication. It's an injection that you take weekly, and it does result in some pretty profound weight loss without really changing anything else that you do in your life. One of the things that we want to do here at A Body Renaissance is we do want to help you make some lifestyle changes so that you can maintain long-term weight loss goals. Real quickly, we'll just go through the highlights of this presentation, but we're going to talk about first, what is semaglutide? How does it work? What are the most common side effects? Who should not use semaglutide? How and when you will inject the medication? How long you will expect to take the medication? And then how to achieve long-lasting weight control. So what is semaglutide? Well, if you're in the medical field, we call them GLP-1 agonists, but really what it means is it's a medication that was created to help with diabetes, to make insulin work better, and to manage blood sugar. So over the last couple of years, the drug was shown to cause such great weight loss in diabetics that honestly some of them actually weren't even classified as diabetic anymore. And the FDA found that it was pretty safe, pretty mild side effects, overall, and have approved the drug for weight loss. Now there are certainly going to be some people who won't be good candidates for the drug, but it really works for most people as long as you are overweight. This isn't something that will be prescribed to you to lose 3 to 5 pounds. That's not an appropriate use of this medication. You cannot use it if you are on insulin. This is for type 2 diabetes, not type 1 diabetes where insulin is required, because it does increase the effects of the insulin in your body. And it is an injectable medication. So if you have any kind of, problem with needles or giving yourself an injection, you may need to either find somebody to help you with these injections, or this might not be the right drug for you. At A Body Renaissance, we're not going to have you come in weekly to do these injections. These are going to be something that you'll do on your own. You'll come in monthly for follow-ups, and we'll do weight checks and try to help you with other parts of your overall health, but we will not be doing the injections for you. So that is something to consider. This medication, it affects insulin, it decreases the sugar production from your liver, and it slows down gastric emptying. And those are the 3 ways that this medication helps you to lose weight, because when you add all of those 3 things together, your body will have to burn fat for energy and will finally let go of some of those stubborn fatty areas that you've had such a hard time with. Well, how does it work? So, like we have just discussed, it was created to help with diabetes management. So, probably not a big shock that it actually improves insulin production and sensitivity. It makes the insulin you have work better. It helps your pancreas produce more insulin. And insulin is the primary way that sugar gets from the bloodstream to our cells. It's how we feed our cells. It's very important. Probably helps to explain to you why sometimes you've eaten and you still feel hungry. Your cells aren't getting the sugar from your bloodstream after your body has digested it. And so they're triggering your brain. They're calling up there and they're like, hey, we're starving down here. So what does the brain do? Well, it tells the liver, go ahead and make some sugar or glucagon. And that comes from the liver, goes into the bloodstream, and guess what? That insulin is still not working very well. So then you end up with even more sugar in your blood, And at a certain point, your body actually takes that extra sugar and attaches it to a triglyceride and stores it in your fat cells. And usually in the abdominal area for most people. So you get that what we call truncal obesity. And it's very stubborn, and it causes a lot of other issues. Metabolically, fat in your belly is linked to high cholesterol, high blood pressure, all of those other things, heart disease and things like that. So getting rid of that belly fat is really important. So semaglutide overcomes this by, as we had talked about before, making that insulin work better, stopping sugar production. And the third thing that it does is it slows down your digestive tract. So you feel full a lot longer. You don't need as much food to be full. And honestly, in the United States, we probably eat 4 or 5 times the amount of food that we actually need to be healthy at each meal. We probably need what we can fit into our hand. Maybe, that's a gross overestimation, but we eat a lot more than we need to. This is going to make you feel full, and it is going to make it hard to overeat. Your stomach won't want it. You'll feel pretty bad if you overeat. So it teaches you portion control, and with all of those 3 things combined, you actually burn fat cells and lose weight. What are the side effects? Well, as we've talked about how this medication works, we talked about it slowing the GI tract down, so digestion. So the majority of the symptoms are GI related. Nausea is the #1 reported symptom. If you start with a low dose of the medication and work up slowly to the recommended full dose, usually these side effects are very mild. Some people do have a little bit of a harder time than others. Some people have vomiting with the nausea. Diarrhea and constipation are common complaints. Belching, flatulence, and abdominal distension are, common with some people. It can even get a little bit worse. You can have a full gastritis where you just feel like, almost like you have a flu. Dyspepsia, like worsening gastric reflux, or even new gastric reflux. If you've never had those symptoms, this drug, because your stomach and everything slows down. If you overfill your stomach, it will probably create a situation where the acid may come back up. You'll also have a decreased appetite. And for some people, you could have an injection site reaction, like you may get a little bruising, some redness. If you are using good, clean technique and you're cleaning the area and you're doing the injections appropriately, you should not expect to have any kind of problem with injections. Certainly, we wouldn't expect an infection. But if you do have a history of skin infections, cellulitis, things like that, then this may not be the right medication for you because you are going to have to inject once weekly. Now, to combat these side effects, really most of these things can be done with over-the-counter medications. Over-the-counter Prilosec, if you have a predisposition for, say, acid reflux, it would be a good idea to take a Prilosec every morning, and possibly while you're on this medication, since it's only going to be a limited amount of time, maybe you take one in the morning and one at night, or maybe you take some Tums before you go to sleep, something like that, something to reduce the stomach acid. If you're really severely nauseated, we will provide a script for something like Zofran that you can take on the day of the injection. Most people truly don't need it if they're titrating the medication slowly. And if you're suffering from diarrhea or constipation, again, there are over-the-counter remedies. Diarrhea is actually pretty low, but people who do suffer from that with this medication, it can be pretty relentless, just kind of constantly every day. And you may have to consider electrolytes, drinking some low sugar Gatorade. And I only say low sugar because the high sugar Gatorades can actually pull a little bit more water out of your body. It's not because you have to monitor the sugar intake while you take this medication. But for the most part, as you can kind of see, I mean, for all of these things, belching, abdominal distension, you can buy Gas-X over the counter. It's really more supportive care. So you just want to kind of see what symptoms you have, and then we'll try and treat them. Usually eating smaller portions and titrating the medication slowly, it is sufficient to help with the biggest symptoms. So who should not use semaglutide? One of the biggest side effects is a risk of thyroid cancer. If you have had medullary thyroid cancer, or any type of thyroid cancer for that matter, you shouldn't take this medication because you do have an increased risk of that. If you have kidney disease that's uncontrolled or stage 3 or higher, this may not be the right medication for you as well. Because you are, your lymphatic system is going to be carrying away a lot of fat, and that's going to be carried out through your kidneys and your urine. If you do have kidney disease, asking your kidneys to do that kind of work may not be a good idea. It could result in, a worsening of your kidney function. So we would not prescribe that for you if you have uncontrolled kidney disease, or if it is stage 3 or higher. If you have a history of pancreatitis, this can induce pancreatitis in some people, so we would not want to prescribe that for you if you've had an incident of pancreatitis, especially if you've had multiple issues of pancreatitis. If you have a history of gallstones, you at least want to be careful taking this medication, because you are now going to be utilizing fat for fuel. It does create a situation where your gallbladder might be producing more bile, and you could end up producing more gallstones. It's just part of that metabolism where the gallbladder is like, hey, I want to help, and sometimes you end up with stones. So if you've had your gallbladder removed, then that's not a problem. You are fine. If you've had a history of gallstones, and it's really a long time ago, you're probably okay, but at least it's something you want to think about, because it can increase your risk for gallstones. If you have severe GI disorders, this would not be probably a good medication to take, because it could exacerbate issues that you already have. If you have severe acid reflux, you really want to consider whether this is the right medication for you. I'm not saying that we can't try it, and there are other medications that we can do to try and help coat the esophagus while you're titrating this medication, and we can even titrate slower for some people to help alleviate some of these symptoms. But it may not work out if you have some type of GI disorder already. And this is just really a personal thing. If you are intolerant to slight discomfort, this is probably not the right medication for you. I mean, if you call and you're like, I get nauseated every day, we're going to say, we told you that could happen. These things happen. You may be one of those people that has to kind of have a little bit of a GI discomfort the entire time you take the medication, and you're going to have to decide if that is something that you're willing to do for, really good weight loss. If it's not, that's okay. I mean, some people just do not want to have any kind of discomfort, and that is just fine. But if little discomforts, if a little bit of bloating, if some mild stomach cramps are really going to cause you a lot of stress, this is probably not the right medication. Certainly, I think it's always worth giving it a try, and if it's too much to take, you just stop taking it. It's not like you have to take this medication. But just be prepared. You're not going to get a ton of sympathy from our office for this. We are warning you that there are GI side effects. And if you do have these side effects and over-the-counter medicines or even some prescription medications don't help, There's nothing else we can do. There's nothing to solve this problem. It just happens with some people, and you'll probably have to try and utilize some other type of weight loss medication. So how do you inject it and when do you inject it? Well, the when is totally up to you. You can choose which day of the week you want to start this. We normally have the weight loss medication start on the day that you come pick up the medication, but you do not have to. You can come pick it up and you can start it, let's say, on a weekend. I mean, some people want to take it on, Friday afternoon when they get home, in case it does make them a little nauseated, because maybe they have Saturday and Sunday off and they won't have to be at work, feeling poorly. That's perfectly fine. It doesn't matter which day you take it. You do have to take it on the same day every week. It is a subcutaneous injection. That means it's in the fatty tissue. So wherever you can grab some fat, you can inject this. Truthfully, you could inject it in the fat in your calf if you wanted to. I don't suggest that. I think people do a little bit better if you use like the upper thigh love handles, if you can reach your own love handle. And abdominal fat is always really, really good. So we're going to give you a calendar, and it's going to have the schedule of how much medication you take 4 weeks out. We require that you come in every 4 weeks and do a weigh-in, and we'll talk about how you're doing with exercise and diet and symptom management and things like that. And then we'll give you the next 4 weeks of, dosing. So you're going to start out at a pretty low dose. And that's a really good thing, because your body will have a chance to get used to it. And these GI effects that we talked about will be much more mild, and your body will just kind of adapt to those. And so as we increase each week a little bit more medication, you have a chance to kind of catch up. People who take the full dose the very first week have profound nausea and other side effects, and they are really miserable. People who start low and just kind of move up slowly sometimes are achieving weight loss at very low doses and don't even ever have to get up to the full recommended dose, and still have really, really great weight loss with lower symptoms. So that's our goal. We want to find a point where you get the weight loss you want with low symptoms. We are going to teach you how to pull this medication out of the bottle into the syringe, and then how to inject yourself. That will be done at the appointment when you come to pick up your medication. So how long will you have to take semaglutide? Well, it's going to be different for everybody. If you have 20 pounds to lose, and probably if you're a little younger too, you might lose that weight pretty quickly. But we are going to recommend that you try to take this for at least 6 months to get the best long-term benefits. This medication, when taken for longer than 6 months, helps your pancreas for a long time produce better insulin. So if this is truly the cause of you not being able to lose weight, taking this medication for at least 6 months should be a goal. And the way that we can do that so that you're not losing too much weight, because there's definitely a point where, there's too much weight loss, we just titrate you down to a lower dose. So if you are, 1 month in and you've lost 15 pounds, we aren't going to keep increasing your dose. We're going to keep you at a low dose and let you gain those benefits of improving your insulin over, a 6-month period, so that you can actually have improved pancreatic function for a lot longer than 6 months. It's shown in the studies that after 6 months, people have improved pancreatic function for years. So we definitely want to take advantage of that if we can. And like we kind of already talked about, really we're going to try and find the lowest possible dose that works with the least amount of side effects. So everyone will be on a little bit different dose. The highest amount that you would ever take would be 0.5 mLs. And, a lot of you probably won't get to that because it's going to work with less. So that's, kind of the cool thing about this medication is once you find that you're losing some good weight and you're not having side effects, there's no need to keep increasing the dose. So we really want to help everyone achieve lasting weight control. Anybody that's ever struggled with their weight knows that every once in a while you'll find this great thing. It'll help you lose weight. You'll start to feel like, oh my gosh, I've got control. And then something happens, some kind of family, event or tragedy or, financial situation, a little bit of stress, maybe just a few bad eating days turn into a few bad eating weeks, and the next thing we know, we're 15 pounds heavier than where we started before we even lost weight. And we want to avoid that. So achieving lasting weight control, you cannot do it without changing your eating habits at least a little bit and getting some kind of physical exercise. Our bodies were meant to move. They are meant to continue to be strong. We need to do aerobic and strength training exercises. The more muscles we build, the more fat we burn. So we do have to try and do what we can to improve our, metabolism. And then portion control is a really big thing. Like I had said earlier, we just eat too much. We sit down, and mom has cooked us this big Sunday dinner and we heap the food on there. And then for some reason, even though we're full, about 10 bites in, we continue to force ourselves to eat until our stomachs are bloated and full. And you cannot be a healthy weight if you do that consistently. It just, our bodies were not meant for that. They just weren't. And so, yes, there are some people in our society that seem like they can eat anything and they don't gain weight. And something genetically is different in them than it is with most of the rest of the population. It doesn't mean they're healthier necessarily. It just means that they're not putting fat on their bodies when they overeat. But it's not healthy, and hopefully you will learn better portion control, because this will decrease your appetite, and it just in general, it will make it so you don't want to eat as much in one sitting. And as you titrate off the medication, we'll have some things to help keep you mindful of, okay, do I really need to eat all of this? Or is it okay if I just put a little bit on my plate? And then if I'm really still hungry, I can go get a little bit more, but I don't have to heap everything on there and then finish the plate, because, we've always been taught, finish everything on your plate. We're going to tell you to do something that is going to go against, some people are going to have a really hard time with this, but we're going to say, when you're full, throw it away. Get rid of it. Do not keep eating. These things that we've done to ourselves with, finish everything on your plate, have created very bad habits. And now we're just overeaters. The reason that our insulin becomes resistant and the reason that we hold on to this extra weight is in large part because we eat too much. We indulge, we overeat, we eat the wrong kinds of foods. So I'm not going to tell you to stop eating any kind of food. If you're going to a birthday party, eat the cake. If there's like some big family event, eat the desserts. Eat the things that you love. Just eat less of them. And while you're on this medication, you probably won't really have much of a choice. You're just really not going to have a huge appetite. But in general, try and eat some healthy things. Try and get the healthy things down first. And then, maybe you're only going to want one little bite of a sweet, and that's going to be okay. And we'll talk a lot about this, that when you come in monthly, we are really going to continue to push, hey, are you finishing your plate even though your body is telling you, I am full? We really want to start listening to our bodies and slowing down when we eat, and taking that moment to say, okay, I've eaten about 3/4 of everything that's on my plate, but I really feel full and comfortable. And if I keep eating, I'm probably going to feel bad. So maybe I should just stop now. These are the kinds of conversations that hopefully you'll have with yourself. And by the time you're not on that medication anymore, you will have created some healthier eating habits. This is really kind of the whole point of the program, is to help you lose that stubborn fat that has been basically impossible for most people, and also to create some healthier eating and exercise habits so that you can achieve lasting weight control. This is the end of our introduction to semaglutide presentation. Now that you have a little bit more information about the medication, and hopefully you understand that the medication is only part of the overall program, you can now choose to start the program. If you do, that's great. We'll go ahead and get more information from you. We'll get the medication ordered and get you scheduled for your first follow-up. We'll have you read and sign the consent form that basically reiterates everything that we've discussed here, but it just ensures that you have understood it. And if you do have any questions, we really hope that you'll ask us all of those questions before you sign the form. But we are excited to help you with this. We are not just providing this, we have used it, and we know that it works, and it has made a big difference in our lives and how we feel about ourselves, our energy level, and our ongoing physical, efforts to be healthy. It was a lot easier when weight was coming off. Most people have been in that position where, you're working out and you're eating right and you're doing everything right, and you might lose 5 or 10 pounds and then you just stall and nothing's happening, and it's so frustrating. And this changed that for us, for everybody in this office, and everybody that I have prescribed this before you. That's what changed for us, is all of a sudden that weight loss continued to come off, and we felt, more energy, and we were able to work out better and harder, and it was more enjoyable to work out because we could see physical changes happening to our body. That is the point of this. And if this is something that you feel like, would be a benefit to you in your life, we would be so happy to help go on this journey with you and help you achieve, long-lasting weight loss. So thank you for listening to our presentation, and let us know if you have any questions.